Hello, welcome back to Prairie Orthopaedic and Plastic Surgery. I am Dr. Machado. I'm a board-certified plastic surgeon with fellowship in hand and upper extremity. Today I want to talk about this special technique, and it's called WALANT. Well, it's a long name, so what is the meaning of WALANT? WALANT is an abbreviation for Wide Awake Local Anesthesia No Tourniquet. In hand surgery, we use a tourniquet to help us to perform a procedure there is no blood. In order to use the tourniquet, it causes pain. Imagine if you have a blood cuff on your arm for an hour. People don't tolerate that well. For this reason, we usually either use general anesthesia or a regional block combining with sedation. So a group of surgeons in another country, Canada, start studying a way to avoid using the tourniquet. We all use lidocaine for the numbing medication, but we combine a medication called epinephrine. It's actually really old, this medication. But unfortunately, we have not used this in hand surgery because it was banned, because it was suspicious to be causing necrosis, meaning dying of your fingertip, of your toe, of your nose. So we start using this medication, and they prove to be a very safe medication. When you do this technique, you can perform the exact same procedure without requiring a tourniquet. For this reason, I want to bring to you what are the advantages of using the WALANT. Several studies have been done, so let's think about it with me here. If you don't use tourniquet, so you won't need sedation, right? So if there's no sedation, there's no need to get an IV, so less pain. So if there's no sedation, you don't get narcotics medications, so you get less nausea. So studies were done which they compare, okay, let's compare a very simple hand procedure, which is carpal tunnel. And they compare a group of people receive just local anesthesia and the other group sedation. And they compare that both of them, they were satisfied with the surgery. However, the group that requires sedation, they stayed much longer in the hospital. They require preoperative testings by their primary care physicians. Also, they have much higher level anxieties. And the most important point I want to bring to you, the group that receives sedation, they require narcotics postoperatively. They require 67% amount of narcotics compared only with 5%. So, WALANT spends less money, less time, less anxiety, especially decrease your pain postoperatively. So, I hope this video could be educational for you. And if you come to our office, you will see that this is going to be the type of procedure we've done for you. And you will have the ability to go home earlier, to start moving immediately. Thank you very much.